Hi, I'm Dr. Cindy Dupuy. I have a PhD in learning disabilities. I do diagnostic assessment, advocacy, and intervention. I'm also an adult with dyslexia and dysgraphia.
Hi, my name is Kim Sharman. I'm a reading and writing remediation specialist. I work with kids of all ages, kindergarten through college, and yeah, that's about it.
You always crack me up. Um, you don't say things like "I have attention deficit" or anything else,
Okay, I have ADHD. There we
but
go.
we've shared that before. But
Yeah.
that's also part of what makes you fun, Kim. All
Well,
right,
and they can
so
figure it out when they watch me.
we're not going to diverge too much today. We're going to talk about confidence intervals because we've gotten questions on confidence intervals. So, Kim, and I know I'm doing this and it's mean, what do you think a confidence interval is?
Well, first I think of it as a statistical standard deviations, but I know it's not a standard deviation, but my guess is that a confidence interval has something to do with the accuracy of the test itself. No?
Sort of. You're not far off.
And
That's sort of
so
right.
sort of right, but it is it have to do with the test or it has to do with the kids' results from the test?
Has to do with the results from the test.
Okay.
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 So what I did is I went in and I created a Microsoft Word document really quickly that I put in a score, like a standard. So that should be a standard score. Um, so if your standard score is a 72 and you're in the third percentile, we have a 90% confidence interval and we have a 95% confidence interval. Okay.
That score is correct? I don't understand.
Okay. So that's why we're doing this. So a confidence interval says every person has some variability in their performance. Okay. So if I were to go back and re-administer a test on a different day, how would you perform on that task?
Oh.
Okay. And so at a 90% confidence interval, that says if I were to give you the test again, there's a 90% chance that you would score between 68 and 78.
Oh.
And there's a 95% chance that you would score between a 67 and a 97 or a 79. Not that I'm dyslexic.
So a 90% chance that you will score within a particular range of your original.
Or a 95% chance.
Okay.
Okay. So if we were going to represent that graphically, and I were to focus my camera
That's good.
and draw my infamous bell curve. And of course, we picked a low number first. So let's look at the 105. So let's say you had a score of 105, which is smack in the average range. Okay.
Uh-huh.
The band of what we would consider a 95% interval would be that you would score between 100 and 110. So that would be a 90% chance. Okay. And a 95% chance would be that you would score between a 99 and 110. Okay. So I'll draw a 99
Yeah.
down here and
So you made it a little
110.
bit bigger. Okay.
Yeah. Okay. And the idea being that, and I'll draw that out there. The idea being that everybody has some variability by day. Now, let's take a look at something that's equally interesting. So we talked about it being, let's take a look at the 72. So a 72 down here. We said the confidence interval would be a 68 to a 78, right?
Yeah.
So you'll notice that going this way, there's a 4-point difference, and going this way, there's a 6-point difference.
Okay. Can I ask you a question?
Sure.
One time, many years ago, I asked you why a student was initially evaluated as having 115 IQ, and then a
Mhm.
couple years later, after some difficult incidents, the kid was evaluated having a 90 IQ or something, and you said like, does confidence intervals play a part in saying that's statistically impossible?
Saying something else. So statistically, that would be unusual. So if I took a kid with a 72 IQ and they suddenly score, let's call it a 90 IQ, and nobody look at my graph here because that's not beautiful, right?
Right.
Something happened there that you jumped from a 72 to a 90. But if I take that 72 and then they suddenly score a 77,
Right.
that would be considered within the confidence interval.
Would this be an example of a kid maybe who wasn't on ADHD meds and then took ADHD meds?
So I would say the 72 to a 90 would be a case of that.
Yes.
But the 72 to a
No,
77, I would say that's within
that's
normal
normal.
expectations,
It's a
right?
normal variation. Yeah.
Yeah. Now let's go in and take a look at the 125. Okay. So
Okay.
at 125, your confidence interval is a 119 for the 90%,
Mhm.
to a 129. Okay, so you'll notice there's a 4 point difference there and a 6 point difference there. Here we have a
Uh-huh.
6 point difference, and here we have a 5 point difference. Okay.
So the intervals on either side are not, I mean, they're a teeny bit different from the low scores to the high scores. Or
Okay,
maybe,
so what happens is the higher you score on a test or the lower you score on the test, this is what we call regression to
oh
the
my
mean.
God. Now I understand. You never showed me this before. You always talked about it. This is what
Okay,
it means.
this is what it means. So it's way easier when you're low to get one more question right or two more questions right. Does that kind of make
Yes,
sense?
yes, yes.
When you're at a 125, it's much harder to
Yes.
get one or two questions right, and it's much easier to miss a point or two. So you'll notice, and I put in a 105, I should have thrown in a 100, but it's okay. You can see that when you're scoring in the middle of the bell curve, it's fairly symmetrical. Does that make sense?
Yes.
Okay. And so notice at the 90%, it's 5 points either direction.
Mhm.
Okay. And we didn't throw in at the 95, it would be a 118 and a 130. But you get the idea. And
So
down
is
here,
this an
it would be
algorithm that the book people create, or who creates this algorithm of,
it's a statistical analysis.
okay.
So they come in and they look at it, and when they actually administer the test, one of the things that they do is they take a certain number of people when they're norming the test. That's where they go out and they find people all over the United States and they administer the test and they just see how they score. Oh, you're 13 years, 6 months, 27 days. You're 9 years, 2 months, and 3 days, right? We just give them all up and down. And you have a parent that went to college, you have a parent that didn't go to college, you have a parent that didn't graduate high school, whatever. So they get samplings from all across the United States. Some of those people, they will repeat the IQ test within a fairly short window of time to measure how much variability there is in the performance. And they're trying to make it a small enough interval that it doesn't dramatically change development. So if I took a 6-year-old, I wouldn't, like I had a 6-year-old 2 months, I wouldn't wait until they were a 6-year-old 6 months, because in that 4 months as a 6-year-old, there is a lot of developmental change.
So you
Whereas
don't
if I
want
take
to,
a 13-year-old and I wait 4 months, I'm not going to get as big a developmental change. Not that the 13-year-old will be at a 125, but you're getting the idea that the younger you are, the more gains you make in a very short period of time, and the more sensitive the measure can be.
can I
Yeah.
say something that I just put together?
Okay. I love your aha moments. Go for it.
So a long time ago, Cindy taught me that if a kid performs in an IQ, let's say at 115, in the IQ test. But then in one of her academic subtests, or right, is that what you call the other tests that define learning issues? An academic subtest, that kid will score 125 or 130 or something crazy. And what Cindy says is that is something is wrong with the IQ test. You cannot have that academic subtest outscoring the IQ.
Well, let's get a slight caveat on that. There's
Oh,
something called a savant syndrome. So we have individuals that you can give them a birth date and they can tell you what day that individual was born on, that day of the week. But that
oh,
is different. And we can have people that are naturally gifted at math, but you shouldn't consistently outscore your IQ by 10, 15 points on multiple measures, is what you're saying, which
yeah.
I 100% agree with. So if IQ is intended to measure how well you perform in a general education environment, meaning I am dropping you in the public school system and can you keep up academically or not? If your IQ is 100, you shouldn't be scoring a 120 in reading comprehension and a 120 in your composite math score, like, and consistently outscoring your IQ.
How often does this happen, or how often do you see reports from schools or other persons where you see that?
I say it actually frequently happens.
But that's frightening because that means, tell them what that means then.
It well, it means that the clinician isn't understanding some of the principles of measurement of Nate and the measurement and nature of intelligence, right? Like the whole point of an IQ test is to predict how well you're supposed to be doing in school. Like that's the whole reason Binet did it. And so if the academics don't fall within the confidence interval and you consistently fall outside of that and you outscore it, you've got to question, did the IQ test accurately assess their intellectual potential, or did it assess something else? Did it assess depression? Did it assess a student's self-confidence and willing to get a verbal answer? Did it assess their attention? Did it assess a whole slew of other things?
But I thought you taught me that sometimes also different IQ tests hammer on the disability of the person. If the person has dyslexia and they have slow retrieval or whatever, and that IQ test hammers on
Yes.
reading speed,
Yes.
the wrong, you have to give them a different
Well,
IQ test.
all right. So an IQ test doesn't involve reading. Let's just clarify
Right.
that.
Yeah.
But yes, I can give the same student a different IQ test. And by the way, when we talk about this in individuals that don't have a learning difference, if I give you a Stanford Binet and I give you a WISC, the number should be pretty much the same. They should fall within
Good.
confidence intervals.
Oh, okay.
When I take a kid with a learning difference, they have a processing speed deficit, they have a word retrieval issue, they have other issues going on. I may be measuring that bottleneck in their brain wiring instead of their true intellectual potential. Does that kind of make sense?
And I think most people don't know this, and the schools don't really want to hear this because I've mentioned it to them before, that you're hammering on the disability. You don't have the right IQ for this kid.
Right. Now, they do acknowledge it at some level. Otherwise, we wouldn't have general ability index scores where they say, let's drop out the
Ah,
working
that's the
memory.
reason for that? Okay.
Yes, let's drop out, or a nonverbal IQ. Let's drop out the verbal based tasks. So there is some acknowledgement that the profile of students that typically get assessed in schools have something going on with their learning, and working memory and processing speed tend to be two big items that can pull down the full scale IQ. And so that's why you have a general ability index score. And calculating that gives us a sense of, is there a lot of variability in their performance on the IQ test?
So if a parent sees general ability index score calculated, that's not always calculated. They've done that because they know something's up with the, or is it always calculated?
Clinician, it varies by clinician. It varies by clinician training. It varies in a lot of different ways. A lot of people are taught the mechanics of how to administer an IQ test, and are given fundamental basics, but it's one of many classes that they take. And there's not as much emphasis in the interpretation or trying to understand what the IQ test tells us.
I
And
just remember,
so,
yeah, I just remember I gave you a kid once and I said, something's wrong here. And I can tell how smart this kid is, but he's being presented as flaky. And you had to do several different IQ tests until you found out he had an auditory processing issue.
yeah. I'd have to pull up those numbers to remember how I got there, but yes, I will often do more than one IQ test because I'm looking to better understand what's happening with the student. And one thing that drives me nuts, though, is when a clinician will say, well, 3 IQ tests were administered, so we'll take the average. Well, that's not the point.
That's not the point.
The point is we have to pick the right test to understand how the student learns, what their strengths are, and where the bottlenecks are. Because if you don't understand that, I mean, what you do when you work with kids is you work on bottlenecks. You work on opening up those bottlenecks. Let me build your vocabulary. Let me build your phonemic awareness. Let me teach you some different thinking skills so that when you hit unusual things or things that you've not seen before, you have internal dialogue for problem solving to work more complex problems, right?
Right.
So you're working on a bunch of different things. You're working on oral language skills, even though you're not trained in that because that happens in reading instruction. So the other interesting thing that shouldn't happen, and we see it happen all the time, is we see a shift up in IQ scores. So I have kids that have gotten years of really good intervention. They've worked with a speech language pathologist. They've worked with you. And we test them initially and their IQ score comes out at one level. They come back for a reassessment and they gain points far outside of what the confidence interval would say.
Really?
Oh, yes. A student that you and I worked with together frequently, because you
Outscored
were
it.
teaching decoding, had a
Yeah.
shift up of multiple IQ points, like 8 points,
Wow.
which is really hard to do.
Huh.
Might even been more than 8 points, but I see that all the time. So again, IQ, like in what we would consider the normal population, the theory is it's relatively stable. But when you have kids with learning differences, those learning differences can get in the way of them showing off what they're capable of doing. And the intervention that we do on different levels can help remediate some of those bottlenecks that before impaired their ability to fully demonstrate their potential. And so the value in that confidence interval, coming back to the main topic,
Yeah.
is to look at that and understand that a little shift up or down is normal. And you want to know what a confidence interval is. They actually have correlation scores, which we'll do in another session, where they compare IQ against achievement to say, does it fall within the confidence interval or something weird going on here? I naturally calculate that because I have a piece of software that plugs in this, what looks like a gnarly formula that's not. And it calculates the correlation coefficient to say, what's the natural overlap and does the score fall within what we would expect given that correlation to determine whether or not there are gaps in the learning. And so, again, the point of the confidence interval is to give parents an understanding that in a typically developing individual, if you went back and gave the test again, you would expect some change in scores.
I see.
Okay.
Not normal.
And when you have scores that consistently exceed the bands in different ways, that maybe there's reason to call the IQ test into question as it may underestimate, which is how we move into assessing students using what's called a pattern of strengths and weaknesses. And that's where we compare academic achievement to academic achievement and say, is there a gap?
Okay. Now
Does
I
that
know.
make sense?
Yeah, I finally understand regression towards the mean better now, because I knew how to say it, but I wasn't sure. I didn't realize it was based on confidence intervals.
Scores fall towards the middle of the bell curve.
Right.
The farther out you get on the tails,
The
the
more
more
go.
likely is you're to fall to the middle.
Okay. Got it.